So everybody gets 1 or 2 rotations a semester. Well, you'll get 1 or 2 rotations through Smith while you're here with us, except for the men. The men are not allowed on that floor. Okay, the manager has requested that. So if the men want to get breast, they can get it at LBJ, or we can do it in the lab on one of y'all. I'm joking. We're gonna choose the biggest boobs in here.
No, we have a financial.
Because men need to know how to do breast, because very few men specialize in breast. But you know, we do have them come in through the emergency room, especially nursing mothers that get an abscess, or women that have been in a car wreck and then they've had trauma from the seatbelt. Then we do breast on them also. Okay, but most of the time it's just the women. So the guys you'll probably be testing in the lab. Okay, that's how you'll learn how to do it. Okay, so for us to be able to do an invasive procedure, we have to keep the area sterile. Okay, now there's some exams that we do that are semi-sterile. Okay, so let's go ahead and quickly just go through this so that way I don't forget to tell you what we're going to do. Circles, we're not going to go through the objectives. Okay, so invasive procedures. Invasive procedures require some work from us. A lot of times we're the ones that set up the trays. Okay, so we're going to teach you how to put on gloves. We're going to show you how to process the setups of the trays. And we're going to show you what you need to do to keep that environment as sterile as you can. If you are questioning whether you touched something or you think you saw someone touch something, automatically it's non-sterile. If you have any doubt at all, throw all that away and start over. Okay? If you think, oh, did my sleeve hit that? Listen to that part of your brain that says do it over. Okay? So those are the things that we're going to go. So surgical asepsis. Anything to do with the blood, brain, bone, heart, or vascular system are considered sterile. Okay? Just like when you go to the lab and they clean your brachial vein to take blood, they wipe that off with alcohol. That is a form of sterilization. Okay? They don gloves so that way they're not exposed to any pathogens. Those are non-sterile gloves. Okay? Just like what we use in the lab. Has anybody had a reaction to any of the gloves that we have in the lab? Okay, because we switched to last year or 2 years ago, one of our students ended up in the emergency room because come to find out she was allergic to latex. And so we started using non-latex gloves. Okay, so surgical asepsis. What does A mean? Without, none. Okay, so what we're trying to do is when we clean the area, and we do a lot of wounds, we have to lift a lot of dressings. Don't lift those dressings. Let the nurse do that for you. Okay? Because if they have a tube that's inserted in that dressing and you lift that dressing, then you remove the tube. Okay? And that's a major procedure for them to go into. So we try to remove all the germs that we can before we do our procedures. Okay? So all of our biopsies, those are all sterile procedures. Okay? So we wash the skin, we keep the tray and everything, as sterile, so that way we don't spread those microorganisms. If you happen to sneeze on your tray, throw it away. Start over again, okay? We do patients that have ostomies, like colonoscopies or ileostomies. Don't lift those, okay? Get a nurse to do those for you, okay? Because what you're gonna do is you're gonna remove the tape and then you have no way of securing it back. Because most ultrasound departments don't have the equipment. We don't have the bandages like you would find in the emergency room, okay? So if you have an outpatient, there's procedures that you can call where a nurse will come down over from the emergency room and then they will remove that. So that way, and then put it back on whenever you're done, okay? Does everybody know what an ostomy is? Okay. An ostomy is like if I have had colon cancer and they remove my colon and then they've connected it to a bag and then I poop in a bag. Or an ileostomy, then I have urine, you know, and then the patient has to be responsible for emptying that bag and keeping it clean and changing it up.
The patient itself?
The patient itself. Is usually, isn't it, Patricia, it's urine, isn't it? Yeah, it's connected to the ileum, which is the small bowel, and then there's another one that drains the bladder, but it's not a Foley catheter. Some facilities, you might even have to put in a catheter to fill your patients up in the middle of the night. Okay, like some of the smaller rural hospitals. If you want to wait for 5 or 6 hours to fill your bladder up, or they will take a bag and then fill the bladder up through a catheter in the bladder. Okay, so some facilities will teach you how to put those catheters in the urethra. Okay, so depending upon what you have is each facility will let you know what you're responsible for and what you're not responsible for. Some of the smaller hospitals, you're going to be responsible for more than you would at a major hospital. Okay? So patients are going to come to you with open wounds. Okay? They're going to come to you with open wounds. So, like the breast abscesses we were talking about, a lot of them will tear the skin. So, there's packets of sterile gel. Okay, so when you're scanning a membrane, such as Saran wrap. Okay, Saran wrap is a membrane. Ultrasound can't get it through it because there's an air gap on the other side. So what we do is we put sterile gel on, we take some Saran wrap, we pat it with our glove and we keep all the air out of it, and then we put sterile gel on top of that, and then we can scan. Okay, so most facilities will have Saran wrap for those open ones because we can scan through Saran wrap. Okay?
So what about bandage? What about bandage?
It says the sonographer should attempt to examine the area adjacent to the surgical bandage without disrupting them.
Exactly. That's what I said. Don't lift those bandages.
Just so we on the top of
Yeah,
the bandage.
so what you're, like if this is my bandage, sorry, this is my bandage, I'm gonna take my transducer and I'm gonna look underneath it. I'm gonna take my transducer and I'm gonna look underneath it. Okay? I'm gonna angle Okay, so I can get to the areas that I need to see without lifting the bandages.
But,
If I can't, I'm gonna go get a nurse.
yeah, that's what he says also.
If I can't see what I need to see, or if I think I see something and I can't evaluate it properly, I'm gonna go get a nurse.
So if you have to, do you have to remove the band-aid
No.
before you scan?
Sometimes you do,
Right?
sometimes you do, but you never do it without asking permission.
Right.
Or get the nurse to do that. Like abdominal surgeries. If they do an abdominal surgery, they're cut from here to here,
Right.
okay? It's a jillion staples, okay? So they order an exam, but you've got bandages from here to here, okay? I'm gonna go see what I can see coronally first.
Mhm.
And if I can't see what I need to see, I'm gonna go get a nurse to lift that bandage. Because if I lift the bandage, I use gel, that bandage is not gonna stick back.
But it's gonna spray.
No matter how well I dry it off, that bandage will not stick back. Okay? Get a nurse. Okay, get a nurse to come in there and help.
And we should sterilize the transducer in this case?
Yes, we sterilize the transducer after every patient.
I mean,
The tea spray,
yeah,
that's a sterilizer. Okay? Now, if I were to go to the OR or wherever, then I have a sterile sleeve that I would use. Okay, that's part of the OR table, the instrument table, is my sleeve. In that sleeve, you have sterile gel. Okay? Portables, like so, I'm stationed on portables. I'm gonna put some sterile gel in my pocket. Okay? So I might or might not use it, but at least I have it. Okay? At least I have it. Because if I get up there and my patient ends up being a burn patient, I'm not gonna want to use the gel. I'm gonna wanna use sterile gel.
What's different? Is it thicker? The gel is thicker or?
No.
This is sterile.
Yeah,
just
well,
sterile.
it's just sterile gel.
Okay.
Yeah, it comes in a packet. Like, the packet's a little bit bigger than, it's not as small as a package of ketchup. It's bigger than that. Yeah, like salad dressing, it's about the size of the salad dressing that you do.
Oh, okay.
So it's treatment too?
I'm sorry,
It's treatment too? You say sterile gel?
it's sterile gel.
It's steroid.
No, sterile.
Just sterile,
معقم.
okay?
I think it's steroid, okay.
Yeah, you're thinking sterile.
Yeah, yeah.
No, it's just sterile.
Sterile, okay.
Sterile.
Okay, so if I have an open wound, I'm gonna use sterile gel. If I know I'm gonna be close to sutures, I'm gonna use the sterile gel. Okay, because I'm not going to squirt after we've been using the same bottle for a month, you know, not knowing what's on there. Okay? So we try to get as much as we can without removing the bandages. Because once you remove the bandages, then you have to be responsible for putting it back down. And the gel keeps it from, the adhesive from working. Okay, so, like when you're going to get access to Epic. Epic is where we find the laboratory test. Okay? Now, if I have a patient that I know has hepatitis C, or let's say hepatitis A, because it's more infectious. If I know I have a patient that has hepatitis A, I'm gonna make sure that I clean my machine really well. I clean my